he lit a cigarette. Now here's the wee baby hanging out, right? Yes. And we're all like, do we grab the baby? What do we do? And we're like looking to see what's going on. And he takes a little puff of his cigarette and then puts his foot on it, and he walks back in and he says, hand me the symphysis saw. Now the symphysis
I don't know what that is. It doesn't sound good.
I know. It was an instrument that was tucked away in the back of the cupboard in the labour room, wrapped up, and on it was a little sticker that said symphysis saw. Right? So we were all like terrified. We'd never even seen what this thing looked like. So somebody opened it up and put it on his table. Hello there, welcome back to The Bleeding Truth. This is Sally McNally. I'm an Irish nurse midwife and I'm here with my daughter Bridget.
Hey, so that's me. Welcome back to The Bleeding Truth. If you haven't listened to any of our previous podcasts, this is basically Sally's platform to tell her wild stories from the labor room. She's worked in different places all around the world, such as Saudi Arabia, Ireland, Alaska, and now the US. And she does have some really wild stories to share from that, but also some personal crazy stories that, I haven't even heard. So I'm excited to hear more things about you, Mom, every time we do these podcasts. And yeah, so tonight, I'm not sure what topic you want to talk about tonight, but give me a little intro on what you want to chat about.
Well, somebody stopped me in the corridor the other day and they said that they had been listening to my podcast and they wanted me to talk about BREECH. Being a nurse midwife, I'm trained to deliver babies, right? And that includes BREECH positions. So a BREECH baby is a baby that's coming bottom down or feet down instead of head down. So we don't choose to deliver breeches because there's some risks involved. But as a young midwife in Ireland and in Saudi Arabia, of course, I delivered many breeches because it wasn't thought of as an abnormal position or lie for the baby. So we would just go right ahead and deliver the babies. But here in America, of course, they're very careful. And so if your baby is in a breech position, your doctor, your midwife are most likely going to choose a Caesarean section delivery.
That's a bummer.
Yeah, it is. It's hard for the women because they feel healthy, their baby's healthy. It's just the baby's decided they don't want to try coming out that way. But there is the reason why a C-section might be the choice of delivery is because in a normal delivery, the head comes first, right? Or in the usual deliveries. So the head presents with the widest part at any one time. There's a part of the baby's head that's the widest part of the baby coming through at any one time. And if that part can come through, then we know that the rest of this baby can come through. With a breech delivery, we have to wait until the whole body is delivered and then get to the head part to discover if that baby can come through. So in a very, very rare cases, the head is too big to come through the pelvis. And that's called cephalopelvic disproportion, where one is a little bigger than the other. But with the breech, of course, you have to wait to get to that part of the head. So it can be very dangerous. And I've seen the awful scenario that can come from that, of course, as you can imagine.
So does that happen when they're not breech as well? Sometimes the baby's head is just too big to come out?
Very rarely, but yes, the answer to that would be yes, that can happen. But the baby's still safe because the baby just didn't come through, and then, over a certain amount of time, the baby's given lots of time and lots of, ways to make the body contract more and positioning and all of that. And then if it definitely won't come through, then of course the baby will be safe during a cesarean section. And that would be the choice. But if you wait for the breech to come through and you get stuck with the head, well, that's a different story.
How is that solved? What do you do then?
Well, let me tell you the two scenarios that I saw in my own lifetime. The first one, I'm going to tell you the worst story first. And that was a young woman who had a breech delivery at home in her tent in the desert. She was a Bedouin.
Alrighty, so I'm just hopping in here real quick. Sally sometimes jumps right into those stories. So first off, just wanted to say listener discretion is advised, and in this podcast we are saving the questions until the very end. So stay tuned to hear Sally answer some questions at the end of this podcast. And with that being said, there's also going to be a link in the description if you'd like to ask her a question for a future podcast. We greatly appreciate it, and we'll get back to the story.
But this particular lady, she was having like a delivery at home, but it was a breech that got stuck. So the body of the baby came out, but the head, then she couldn't get that out. So it took them like 3 days for some reason, or 2 to 3 days to come to the hospital. And of course, in that time, the poor little baby was dead, and the baby was hanging out, stuck with the head still in. And of course, she was in a very distressed state. She was infected. Her body was swollen. It was a terrible scenario altogether. Yeah. And the obstetrician had to get, if anybody's listening to this and you're pregnant, you might not want to listen, especially if you're breech
listener
and planning a
discretion
vaginal
advised to
breech.
Sally's stories.
Yeah. So they had to get these instruments that were actually little skull crushers. They're like little flat metallic instruments where they slid them in each side of the baby's head and kind of crushed it and then brought it out.
Oh my gosh.
I know, it was really awful. And poor lady was in a terrible state. And needed to be hospitalized and IV antibiotics, and I know, so sad. But so most breeches will come out, right? That's the thing. And most babies head down will come out. There's just that really tiny percentage that we don't know until you get to that part, either pushing, but it's about usually the head making its way out. So the other scenario that I remember was a delivery at home in Ireland with an old doctor. I'll not give his name, but he was well known in the area where I trained.
So how old were you during this stage if you're in Ireland?
Oh, well, I was a young pupil midwife, so I was probably like 25, I think, maybe 24.
That's my age.
Yeah, I was probably about 25,
Wow.
I'm thinking. Yeah, Bridgie. So I was, we were doing deliveries, of course, delivering lots of little Irish babies. Everything was going great. And this day, this baby was breech. And, we were delivering breeches. We were being trained to go out into the world and deliver babies. So we needed to know how to do breeches. And that was many years ago. So of course, it wasn't always a case where you'd have a Caesarean section for a breech presentation. So this day, here comes this breech, and the bottom came and the legs came, and we were trained to have the baby hang out, right? So this doctor was doing the delivery and we were watching and learning. And from when we could see the hairline, right, the maneuvers would move the baby from one side to relieve one shoulder and sweep the arm down in front of the face, and then turn the baby and relieve the other shoulder and release the arm in front of the face and down out of the body. And then the whole baby's body was hanging out. And they used to teach us hands off the breech. So nobody was to touch the baby, and the weight of the baby would pull down and bring the baby into a position that was easy to deliver the head.
Just gravity.
Gravity, exactly. So that's what was happening, and we could see the little baby making like attempts of breathing movements, and the head was still in there and it wasn't coming, right? So the doctor then started for the next maneuver, which was to lay the baby's body over his arm and put his index finger onto the baby's tongue or lower jaw and pull down to flex the head, and then with the other hand to press the base of the skull forward, and that would make the narrowest part of the baby's head come out. He tried doing that, right, and it didn't work. It didn't come out. And we were looking at the clock. It's usually like you want to have the baby delivered maybe 1 to 2 minutes after you see the hairline. You might pull down a little bit of the cord so that the baby's getting a little oxygen, and you can feel the cord, you can feel it still pulsing, and all of these little parts of the delivery are happening there in front of us, but the baby's not coming out. I guess in his heart, the doctor knew it was going to be a difficult delivery. And this was like many years ago in Ireland. He got up and he walked out the door of the room. It was a delivery room, and there was a little glass window in the door, and we could see him right outside, and he lit a cigarette. Now here's the wee baby hanging out, right? Yes. And we're all like, do we grab the baby? What do we do? And we're like looking to see what's going on. And he takes a little puff of his cigarette and then puts his foot on it, and he walks back in and he says, hand me the symphysis saw. Now the symphysis
I don't know what that is. It doesn't sound good.
I know. It was an instrument that was tucked away in the back of the cupboard in the labour room, wrapped up, and on it was a little sticker that said symphysis saw. Right. So we were all like terrified. We'd never even seen what this thing looked like. So somebody opened it up and put it on his table, and it was just literally a little saw, a really neat little saw. So he got a scalpel and he just went straight over, and the lady was trying to push her baby out, and he was trying to do the maneuvers, and he just said, I have to do this maneuver. And he looked at her, and then he went to the work, and he just cut the skin and then got his symphysis and went saw. And honestly, I can still hear that poor woman screaming, because she was having a natural birth. So I know she felt this, but what he was doing was sawing through the cartilage that joins the front of the pubic bone. And it actually gets soft towards the end of the pregnancy, so it's easy enough to saw through it. And it's not bone that he's sawing through, it was cartilage. And he just didn't stop. He just kept going. And then he once he got all the way through, the pelvis just went pop, pop, and the baby came right out. It was amazing.
Wow.
It was so amazing. And the baby was fine. The baby started crying and was just
But the
beautiful.
poor woman.
The poor woman. She, of course, had to stay with us for like a couple of weeks. We had bound her hips together really tight to bring that cartilage area back together. But her baby was alive. And I honestly don't think the baby would have survived had he not done that. But I often remembered that, and I thought, well, would I have that courage to do that if I was ever stuck in that position? And luckily now here in America, I don't ever have to worry about that, because all these BREECH deliveries that are in the hospitals where I work, they're delivered by Caesarean section.
Gotcha. Okay. So when it's noticed that the baby is breech with the feet down, right?
Feet down or bottom down.
Oh, okay. Is it not something that they can be moved, like by positioning, or I know you sometimes do like yoga poses with them and stuff.
Yeah. Well, there's a group out there, they're wonderful, they're called Spinning Babies. And they have a few moves that the mother can do every day, maybe a few times a day, to get her baby to turn naturally. And that's wonderful. For me as a yoga instructor, I get them straight upside down. I put the woman right upside down. I have a yoga wall. I can put her in a pelvic swing and get her upside down. Or I can get them between two chairs with their head down and their feet up against the wall. But really the idea is to get the baby out of the pelvic region. And sometimes they don't like this new position that you put them in, and they just naturally turn.
Oh, wow. So is it something that's noticed like weeks in advance, or... Okay, so you can detect that it's breech with an ultrasound or something.
Yeah. The baby usually settles into the position around 33, 34 weeks after that, they usually don't change their mind. They stay in the position. Uh, and some doctors will actually do an external version where they'll give the lady, bring her into the hospital, give her a medication to relax the uterus, and then manually turn the baby. I've been trained to do that also, but we don't do it that often. But we would manually turn the baby, just pushing the baby around the whole abdomen, bringing the baby's head
Like
down.
with your hand?
Yeah,
Wow.
with two hands, yeah. One on the bottom and one on the head.
Wow.
And it's very interesting. Sometimes it works great, and sometimes it works and the baby then decides, no, I want to go back the other way.
Yeah.
But there's risks to all of these, the maneuvers, the turning her upside down, because the baby can get tied up in their cord as well if they're doing like big turns at the end, you know. So you should always be able to listen into the baby's heartbeat afterwards and make sure that the baby wasn't bothered by any of it. Yeah, but there's some things that the women can do. And now remember, breech is not an unusual thing. It's just that little bit risky. So your doctor is probably going to decide to do a Caesarean section because of that risk, just to keep you and baby safe.
Yeah.
And a lot of women don't really understand what is the big risk, but that's it. That's my bleeding truth, what I've observed. And even, you know, if a woman came in and the baby was coming breech and it was a very fast delivery, I think I would remember all my maneuvers if the baby had to be delivered that way. But you know, I would err on the side of caution too, that if I had a choice, I'd rather do the C-section.
In that case, yeah. Those two stories you referenced were really quite something.
I know, poor babies, but one made it and the other didn't, just because the you know, where she was in a tent in the desert, days away from us, versus being right there surrounded by midwives and this very skilled doctor. So I think that we should support women's decisions in the type of deliveries they want to do, but the women should also, you know, allow us to give them this informed consent, to tell them the risks, you know, of what their choices might be. And then they have, you know, all of their options.
Of course, yeah. Do you think that's something that is lacking still? Like fully informed
I do.
patients?
Yeah, I do. I think that there's sometimes I feel like there's a big divide in our population. Women feel like the hospital is a dangerous place instead of the safe place that it's supposed to be, you know. They hear about all these stories that they were forced into having an epidural or a C-section, and perhaps they just don't understand the reasoning why they had that, you know, C-section. And then also perhaps they weren't prepared properly in their childbirth education to understand that they can say yes and no, or that they can ask for certain things, you know. I think the more prepared a woman is before she comes in, easier her labour and her birth experience is going to be.
Yeah.
That I have a great passion for childbirth education. I feel that if we tell the women as much information as they can, including maybe even some of these stories, you know, that a woman having a breech, Caesarean section, that these stories might help her feel okay about having a C-section instead of mourning the loss of a vaginal birth. She might feel like, I feel happy now that I know the risks. And I feel too that the more education we can get to the women before they go into the labour room, the more confidently they can open that door and go in and say, I'm here to get my baby, and to not feel scared, but to feel kind of excited and powerful and confident.
Yeah, absolutely.
Yeah. Even if they decide to have a vaginal delivery, a vaginal breech delivery, that they feel well armed with information and knowledge.
So it is ultimately their choice, unless it's like at what point does it become your guys' decision because of like a extreme situation or emergency?
Well, it's a very litigious kind of place. So most doctors will say no, they won't deliver
Oh,
a
wow,
breech
okay.
if they know that they advise the patient to have a cesarean. There are a few doctors, of course, that will deliver breeches.
Just, yeah, because it's their choice. Wow,
Yeah.
that's interesting.
Yeah, and I kind of miss doing them myself. I'll be honest. It was always kind of exciting, but having seen the risks that can happen, I'd rather all babies decide to come head down at this stage.
Just send out a memo to all future babies.
Yes, please come on, will you? Please.
Maybe they need their informed consent before.
Yes. Yeah. But sometimes we think, maybe the baby has a knowledge in there in the uterus that they perhaps were head down for a few weeks and they sensed my head can't get through that pelvis. I'm going to go the other way. I'm going to.
Yeah.
Yeah. Or their cord is short, or there's some little thing that they know they don't want to go that way.
Do you think that there's anything that is correlated to just during the pregnancy at that age? You said it was like 30 weeks or something, right? Where they stop turning. Is it, if you kept doing more active things, would that keep the baby moving more? Or,
well, that would be hard to prove, but when you think about it, as the women get more pregnant, sometimes some of them are maybe more inclined to lay down more. Maybe being more in an upright position might be better if the baby had been head down, to keep them head down.
Well, yoga would probably be one of the best things that just keep...
Yoga's great, yeah. Because it opens up the pelvis, it stretches the pelvic floor. It's really nice for pregnant women. Plus, we get to hold our yoga poses and pretend it's a contraction. So while we're training like that, it's training the mind as well to be okay with the contraction.
Gotcha.
It's like having a conversation with yourself about the discomfort maybe you feel in your legs when you're holding a pose or something, but you're okay because it's going to end soon and you can breathe and you're in control. So it's hypnosis as well as yoga.
Yeah, the breathing, all of it. How about we answer some questions?
Oh yes, have you got a question?
I've got one for you for this episode.
Okay.
So this one is from our friend Karina, and
hi Karina.
She wants to know, what was it like giving birth after witnessing so many?
Oh wow, I just love that question because it's really important to me, actually, because I had seen all of the things I wanted and all of the things I definitely didn't want to happen.
Yeah.
So I was a natural birther. I knew going in that I did not want, narcotics or an epidural, because of what I'd witnessed. What I felt that the ladies who were doing the natural birth seemed to have a more beautiful experience. Not just the beauty of it, but the nature of it, that it really called to me. I had the secret in my mind was I was not going to have pain medication. And that's, if anybody's listening to this and you're thinking you might want to have a natural birth, that's it right there. That's the secret. You go in saying, I am not going to have pain medication.
Instead of a maybe.
Yeah, it's the maybe that catches you up, because as soon as the contractions start getting stronger, your mind pops in with, hey, remember you said maybe now. So you sometimes give in to that, whereas if you had said to yourself, definitely no way am I going to have pain medication, then you're more inclined to go all the way. So I knew that secret going in, and I try to teach that to women who come to me and say, I really, really want a natural birth. I always say to them, then really, really don't have pain medication. That's the secret.
Mm-hmm.
And, also to not fight the labour, to welcome the labour. That when the contractions come to you, to welcome it like a friend coming into the uterus to do the work for you. It's like a mysterious, ancient energy that just shows up out of nowhere, and it knows what to do. So you have to lay yourself open and ready and accepting, and to really trust Mother Nature's on your side, that what's happening in your body is not, an evil, bad, horrible, dangerous thing, that it's a wonderful opening and a releasing of the best part of you, the best part that you've ever made, this human child. So I think when you don't fight the labour, then you're going to have not only an easier, it may not be easy, but it might be a very exciting union with something ancient in yourself. And it's called woman. It's called, your inner wild wise one. And we all have her. She's there. All we have to do is trust her. And when the labour starts getting stronger and stronger and wilder, release that inner wild one. She'll have, movements and sounds, and she'll, maybe not look like her usual neat, well-kept self, but she's probably going to look more beautiful than she's ever done before. So I do seriously encourage women who have a feeling like that they'd like to be a natural labourer to really go in there thinking, I am a natural labourer. I am, and I can do this. And I did it, and I'm so happy I did that.
Oh.
It was the most beautiful, most wonderful thing in the world. And I can remember all my endorphins so strong in me. And my baby, my beautiful Bridget, she came out, and I could hear myself shouting, I love you, I love you, I love you. So they were the first words she heard. I meant to have this beautiful calm Tibetan bells or something in the background, but she could hear me shouting how much I loved her. I was so wonderful, and she was so wide awake. So not only do you experience your birth when it's natural, but your baby experiences their birth. Can you imagine what that must be like? That, when they come out, their senses are all right there, and they're full of endorphins. And they can hear your voice, they can look into your eyes, they can feel you touching their skin, they can smell your breast milk. It's like the way nature had intended. Now, having said that, having pain medications, there's nothing wrong, of course, for that. And some women, they don't want to experience natural birth. So for you, I would say, go for it, girl. Go get that epidural. Let's get you comfortable, and we'll turn you and make you, into the best positions that are going to bring that baby down. And who cares? It's nobody's business. It's nobody's business, and we'll still have a beautiful birth. Yeah. We'll still have that beautiful birth, and the baby will still experience their birth, of course, and it'll be just beautiful.
Did any nurses try to encourage you to use pain meds while you were there?
Well, yes. I guess, I was releasing my inner wild one. And I think I was moaning, because this low groaning moan comes, and rocking. And Penny Simpkins, she's a wise old woman who has this great book out there about labour support. And but she talks about the 3 R's. The 3 R's are rocking or rhythmic motion, and you often see a child rocking themselves to console themselves, and that shows up in labour. A woman often will rock herself. And then relaxation, when she's coping, she's able to relax, maybe during the contraction, but also in between the contractions. And then the third or is that has a ritual, and that ritual, every time she gets a contraction, it might be a type of movement or a sound. Some women tap or click or make sounds with their mouth. So I had that. I remember having that, and that was really interesting. I could remember thinking of Penny Simpkin during contractions.
Maybe we'll find that book and link it in the description.
Yeah, please. Yeah, that's a great idea.
Yeah.
Yeah.
So what was your like ritual?
My ritual was my sounds. I was making oh. So I think I scared the nurse that was there. I had some great nurses, but one of them, she'd come up and she'd put her head beside mine and she'd say, "Haven't you suffered enough?" Trying to encourage me to have some pain medication.
Bad.
Well, I guess she didn't understand.
Yeah.
And that's where a birth plan can come in really handy, girls, that you can ask not for anyone to offer you pain medication. I was lucky. I'd seen so many at that stage that
you were ready.
I was ready to say no, I don't want any pain medication. But, I can imagine another mother that didn't know that, here's your nurse saying, "Haven't you suffered enough?" You might think, wow, maybe this is more suffering than most people, and maybe I need to get some pain medication now. So it's about coping. It's about coping in labour, and it's about options, and it's about what the woman herself wants. There's no wrong to having pain medication. It's just choices, right?
Right. Yeah, no, that's interesting. I know you also have some funny stories to do at my birth, but we will save those. We can save those for another time.
I have your birth on video.
I know, you've made me watch it.
Oh, I just love that. Let's do it again.
Next year on my birthday. But thank you, Karina, for that question. We really appreciate it. We've had some really fantastic questions so far from you guys, and we will put another link in the description. You can ask Sally anything to do with her stories, midwife, yoga, childbirth education, and we'll answer it in one of the future podcasts. So thank you. That's awesome.
Thanks very much for listening. Anybody who's listening, I really appreciate it, honestly, because I sometimes think, why are you listening? It's just me. I'm just an old Irish midwife telling stories.
But your stories are really, really interesting, and you bring them to life really well, and there's stuff to learn at the same time. If you're pregnant right now, or if you are a nurse, or if you are a midwife and this is your field of work, there are, things you want to hear about other people's experiences and learn from those, and, share whatever knowledge it is that you have. So I think what you're doing is really cool.
Thanks a million, Bridget.
Thanks a million. And so, with that being said, please share the Bleeding Truth with, anybody that you think that might be interested to hearing more of Sally's stories. I'll make sure to put that book in the description below and the question forum. And please make sure to give Sally a like and subscribe if you can. Share it with everybody that you know. Thank you very much.
Thanks a million.
Thanks a million. Have a wonderful night.
Good night. Bye-bye.
Well, or good day if it's the middle of the day for you.